Good evening. Thank you all for being here for this special event on this very special night. My name is Melinda Egging, and I have the privilege of serving as CEO of Sangre de Cristo Community Care. In 1985, Sangre de Cristo Hospice was born, and it came out of a vision from a very dynamic leader, someone we're so proud of, and that's Joni Fair. Joni Fair, along with Dr. Marlow Sloan, came together to bring a dream to life, to really share the hospice movement across Southeast Colorado. And with the help of great partners, Parkview Episcopal Hospital at the time, St. Mary Corwin, it really came to life. Tonight we'll hear from our visionary Joni Fair, and as she remembers how this all began 40 years ago, working alongside Dr. Marlow Sloan, the support of Parkview and St. Mary Corwin, Joni laid the foundation of what would become Sangre de Cristo Community Care. When I reflect upon what it was like working with Joni Fair, I was hired by Joni Fair. What a dynamic woman. Had this vision, started an organization, got all of us to go along with her, and really taught everyone through example on what it was like to truly care, to show compassion, and to lead. Our little community care, such a special, special gift to all of our communities that we serve, and now is rated as the top hospice across the entire Front Range. We really do have a gem. So with that, here's Joni in her own words on how it all started.
Good afternoon. My name's Joni Fair, and I am one of the founders of the Sangre de Cristo Hospice and Community Services. That last year of my educational endeavors, I was in an office at Parkview Hospital trying to put together a program. This was 1980 and 1981. There were only about 5 hospices in the whole United States. I had been there trying to run the program for 2 years when I had a visitor. It was Dr. Marlow Sloan. Dr. Sloan had been asked to come to Pueblo, and they were going to court him for a day, take him around, show him things, take him out to a nice dinner, really showing the sights to him. I don't think they knew at the time that he was born and raised in Pueblo. But anyway, the first thing he asked them was, "Do you have a hospice?" And they said, "Yes." And he said, "That's where I want to go. That's what I want to see." So he came down, he had his wife with him, and they both came to my office, and we talked for probably an hour or two. And I said, "You do house calls?" And he said, "Well, yes." He said, "I'm in much better shape to see patients and go to them than they are to come to me." Well, that won my heart right then. I said, this is who we need really bad.
My dad often talked about the fact that one of the reasons he went to medical school, one of the reasons he wanted to be a doctor was to help people. That's all he wanted to do. He wanted to help people. And he wanted to help people however he could. And so becoming involved in hospice was very much in line with that mission and that ethos and that desire to help patients and people be as comfortable as possible, particularly at the end of their lives. He talked to me a lot about the kind of work he was doing with hospice. He told stories about making house calls and the kind of people he met on his house calls and the patients he had and how what they were suffering from. The thing that struck me throughout all of this was the amount of effort he put into the job. He had his practice, but by the early 2000s, 2004, he had sold his practice, and then he was devoted almost completely to hospice. And once that happened, he was all in, and he put in a ton of effort. And I think often went the extra mile. And I think if you talk to anybody, you'll learn that he put in the extra effort all the time for all of his patients, whether it was making house calls or coming here to hospice house. Starting a hospice house was a really, really big deal to him because it was a sign that hospice had really established itself within Pueblo and within southern Colorado. He did this work and put in the work without any expectation of recognition. He wanted to help people. He highly identified with hospice and the mission of hospice. And so really poured his heart and soul into it. When hospice was started, he was very close to Joni and Wayne, and Lana, of course, was his wife, and they all worked together very closely. And I remember being obliquely aware of or part of meetings they had at the house where they were talking about getting hospice started.
I have to tell you, Joni Fair was not the person that's responsible for hospice. It took, you've heard it takes a village to raise a child, it takes a village to have something like hospice too. Dr. Sloan and my husband and his wife and George White joined us later on. We would meet at each other's house, sit on the floor. We had papers strewn everywhere, trying to figure out how to have a community hospice that was available to everyone. So I talked with the then CEO of Parkview Hospital, Michael Pugh, and told him that we really felt like that this hospice program needed to be a community-based program and not hospital program. Well, Michael was very generous and very kind. He asked about startup money, and I said, we don't have any startup money. We're gonna have to try to raise it somehow. Michael said, okay, Parkview will pledge $30,000 for 2 years. And he said, now you go to St. Mary Corwin to see their CEO, who was Ed Doyle at the time, and you tell Ed what we're doing and that they need to pony up and do the same thing. So we did, and Corwin donated $25,000 for 1 year. Michael also allowed me to stay at home and write all of the policies and procedures that I would need for a home-based program. It took 3 months. Bonnie Finch came on as the first hospice employee other than me. And Bonnie took care of the patients then while I was writing all of these policies and procedures. We found a place. It was in the old District 60 mansion, I call it, down on Abriendo. And we got one room that we could afford to rent. Bonnie came as their social worker, George White, spiritual support and finance. And I was there to do the administrative part. We weren't getting paid by Medicare. We were billing them and billing private insurances, but none of them had paid their bills yet to us. That money ran out, that $55,000. And I said, Michael, we've run out of money and I can't pay the staff. He said, how much do you need? So I told him, and he said, okay, this is going to be a personal loan to you. You're going to sign the contract. And he said, I'll have a check drawn up for you today. I never told my husband because I ended up having to do that 3 paydays in a row. And the price was really mounting up. I think he would have had another heart attack if I'd have told him how much money I was signing off on. Finally, after that 3rd payday period, in a matter of 2 or 3 days, we got about $1 million because that's what we had already provided in services. We still had this idea, though, of having a facility that they could go to if they didn't have anyone to care for them. And so that's how Hospice House came into being.
I don't think anyone could have imagined what the expansion of hospice would look like. 3 patients then, and untold hundreds today. That's a huge expansion. It took a lot of effort, and that was really primarily on the shoulders of both Joni and Marlow. This organization was a new concept in the area. It was a new concept basically in the United States that was pulled in from primarily from England. To see the expansion slowly evolve into an organization such as is here today is truly amazing, and it's a great testament.
My name is Rick Monette. I'm a nurse practitioner. I first worked with Joni back in the days when our office was the 2nd story of the carriage house, and I worked with Joni for a year at that time, and I was so impressed with the impression that the patients that we cared for made on me that I went to nursing school. I was invited to come and work for the hospice, and I did, and that was in 2011. I had known Dr. Sloan prior to that professionally. We worked mostly the inpatient unit. I had other responsibilities, but we grew to be pretty close that way. Had lots of interesting interactions, and he was always a great teacher.
In my first role at Sangre de Cristo, I was a part-time director of volunteers, and that role would evolve into full-time, and using my background in education and obviously evolved to where it is today. Joni also had a vision of starting a hospice inpatient unit. First, we started with some leased space on the east side of town in Pueblo until she built a wonderful, wonderful facility with 10 independent private rooms to really continue to honor, provide care, but also in such a dignified manner. And so watching her take things from a vision to reality was such a gift to work under her. And Dr. Sloan, well, he was a character, even in new employee orientation. He raised me right. He taught me about hospice to really focus on what was important. We have so many rules and regulations and different things that come at us each day, but at the center is what's important, and that's the patient.
Starting a hospice house was a really, really big deal to him because it was a sign that hospice had really established itself within Pueblo and within southern Colorado. He had helped create a facility where people could come and get care, and it wasn't distributed care anymore, it was centralized care, and everything that a patient would need at the end of their life was here. And that was extremely, extremely important to him, and he was very proud of that. But my dad's biggest concern always was, are we helping enough people? Like, there are people in southern Colorado who need help. Are we getting to them? Are we providing the kind of care we need, and how do we do that?
In the early 80s, I met Marlow Sloan, Dr. Sloan, at a time when he was a very active medical oncologist, and he and Joni were beginning to manage hospice-like care within the hospital at Parkview. Because I was seeing many patients who might qualify, they began to talk with me about being a part of the hospice care team and or a part of the organization as they were beginning to develop an organization.
A community hospice supported by both hospitals. And we had not had that before.
Parkview and St. Mary Corwin both contributed funds for many years as support of the hospice program.
Marlow was quite an enigma in some ways. He was the most gentle, compassionate provider with patience, always had the right things to say at the right time.
My dad and Joni, they were very close because they had similar values about how people should be treated at the end of their lives.
You know, I feel like that the only part that I had in all this was that God made it happen. He had my husband in intensive care so that I knew what that felt like to be out there alone. Then he made it possible for me to go to college. The gerontology program being developed, me being the first student going through that, only seeing that one building at the university and meeting the right man there and having a program, you know, that was dedicated to just death and dying. And then to have this other professor that I'd never had, but had the connection with Parkview, to come to me and ask, if that wasn't God-led, I don't know what is.
It's been a remarkable 40 years. Today, we employ over 160 employees. We have a wealth of wonderful volunteers. We touch over 22,000 square miles across Southeast Colorado. And as we look forward to our future for the next 40 years, healthcare is always changing and evolving. And we continue to hear and see what does our community need? What is happening at end of life? And how do we absolutely deliver world-class care right here in Southeast Colorado?
I feel like that I just played this tiny, tiny little role. And I am so happy to see after 40 years that this organization is still going, still serving this community, and has the compassion that's there, the love, the charity to give to others. It's just, it fills my heart with joy. We can always be there for others.
Thank you, Joni Fair. Thank you, Dr. Sloan, for all that you have shared with me and with so many others.